You are watching Good Morning Kenya. Thank you for staying with us. Right now we get into matters health, and this morning our concentration is on arthritis as we zero in on rheumatoid arthritis. And I am joined by a rheumatologist. He's also an associate professor from the University of Nairobi and a consulting physician. That is Professor George Omondi Oyo. Welcome to the show.
Thank you. Good morning.
It's a pleasure to have you this morning. As you let us in on this conversation, we are asking you, is your joint pain a warning? The doctor is here. He'll be letting us know when should it be worrying for you, or when is the proper time for you to start checking on your joints. Do I have to be old for me to start thinking about my joints, or everyone should also just take that responsibility of going for that checkup, that joint checkup? But before we get into all of that, first of all, let's define, when we talk about arthritis, what are we looking at?
Yes, when you're talking about arthritis, you're talking about any discomfort that affects the joint, any pain or swelling that affects the joint. When it's just pain and aches, you call it rheumatism. But now when there's a swelling of the joint, you call it arthritis. Okay. So it is not a diagnosis as such, but it is an acknowledgement that there's a problem with the joint. Yes.
So any kind of pain, any kind of swelling?
Yes, any kind of pain, any swelling of the joint is a warning that you need to see a physician to decide what is the cause of your problem and what you can do about it. And what is it? Okay. Yes.
Can we break it down now to the kinds of arthritis that exist?
There are over 200 types of problems that can affect the joint, but there are few common ones. Let me say that arthritis takes about 10% of medical problems, and 10%, and is the leading cause of absenteeism from work, the leading cause of pain, and the leading cause of early retirement. And the common types are, you start with osteoarthritis, which is degenerative joint disease. And it's like the joint eventually fails to work and needs to be replaced. It's just degeneration of the cartilage. The cartilage gets old. It's like aging of the joint. Then the second one is rheumatoid arthritis, which is among the common inflammation of the joint, swelling and pain of the joint. And it is autoimmune in the sense that the body is fighting itself. The body has got a mechanism of protecting itself from external insults. But sometimes the body can turn against itself and cause inflammation. We do not know why it does, but there are some people who are genetically poised to fight themselves. And therefore you have rheumatoid arthritis. Osteoarthritis affects mainly the older people. Rheumatoid arthritis is a bit younger. It starts at around the age of 20 and peaks. But we also have an element of arthritis in children. We call it juvenile rheumatoid arthritis. Then we also have gout. Gout is high. It comes as a result of accumulation of uric acid in the body and in the joints. And when the body is trying to remove the uric acid crystals, it attacks the joint, and you get inflammation of the joint. Let me just pause to say that gout is largely a lifestyle disease affecting those who are obese, those who are overindulge in alcohol, and those who overindulge in certain kinds of food, especially in our setting, red meat, seafoods, and they are genetically predisposed. And it is the most common, it is the most prevalent at the moment worldwide of the inflammatory arthritis, and is fairly debilitating. And it peaks around 50 years, especially in men. Generally, people think that women don't get gout, but that is premenopausal. Once you reach menopause and you have you are indulging in alcohol, indulging in a lot of meat and so forth, and you are obese and on certain medications, even women can get gout. And it's unusual because in women it comes in areas that you don't expect it. It comes in the fingers, it affects other joints which are already having osteoarthritis, and therefore it makes the diagnosis quite a challenge, and it requires a very high index or suspicion. Yeah. So those are the commoner types of arthritis. But you can have a situation where trauma, when people get injured, especially children who fall down, they get traumatic arthritis. You can bleed into the joints. You can have blood disorders and you bleed into the joints and get hemarthrosis. There are certain conditions in life that can predispose somebody to getting arthritis. You can get something like lupus. Lupus is an autoimmune disease that affects young ladies mainly, but some men. And it affects the skin, the kidney, any part of the body. But arthritis is one of the hallmarks of presentation of lupus. But then finally, there's another one we call spondyloarthritis. Arthritis that affects the big joints and the axial skeleton. The axial skeleton, I'm referring to the spine and the pelvis, the back pain. Is a form of arthritis. And the most common type of arthritis that we don't talk about is back pain. Back pain is the commonest complaint in the musculoskeletal medicine. And the patients, people usually, back pain is the biggest problem and affects almost everybody. But the one which concerns us, the inflammatory back pain, which starts at around 30 years. That's when we investigate. But the older people, again, it's common in older people, but when it comes new onset back pain in older person, you may start looking at other causes like cancer and osteoporosis and those kind of things. So those are the common, we can call them among the top 10 arthritis.
The most common in the country.
The most common in the country and in the world.
All right. Well, you mentioned, when you touched on rheumatoid arthritis, you said the cause is not really definite. There's no definite cause to what brings about, this particular arthritis.
Yes.
So there's no cause. There's no science that backs the cause of it.
No, there are speculations. There are speculations. One, there are people who are genetically predisposed, and it tends to run in families. If you have an identical twin with rheumatoid arthritis, chances are 1 in 4 that you are going to get rheumatoid arthritis. But if you have got a first-degree relative, the chances are 5% that you are going to have rheumatoid arthritis compared with the general population. That's one. The genetic predisposition is there. But there's a twin study which was done in Manchester in the United Kingdom, looking at patients who are genetically identical. There's one group was given normal diet, another one was given vegetarian diet. The ones on vegetarian diet delayed the onset of rheumatoid arthritis, and even when they developed it, it was less severe. So yes, diet is a contributor. But how does diet contribute? Also because your diet determines the kind of bacteria that lives in you, bacteria in your stomach. The bacteria that is in the stomach of those people who take usual diet and vegetarians are different. And this informs the kind of diseases or kind of manifestation that you are likely to have. But that is not all explanation. Because when you go to places like in Ahmedabad or in India, where people are totally vegetarian, you still get rheumatoid arthritis. So people are talking about, are there some infections? And these are one of the areas of research that we are looking at. What is the cause? And what genetics, how does the environment interact with genetics to lead to rheumatoid arthritis?
Okay, let's talk diagnosis. How do you go about, that part, the diagnosis part? When I come to you with a joint pain, where do we begin?
When you come with a joint pain, number one, if anybody with a joint pain should seek medical advice, so that it is decided that out of these many forms of arthritis, which one do you have? Because, if you take inflammation continuing for a long time, times time is equals to joint damage.
Yeah.
It leads to joint damage. So prevention of arthritis, one of it is to appear early. And when you come early, we do medical evaluation. We look at the pattern, how many joints are involved, how did it start, because all those arthritis, they behave differently. You see, like rheumatoid arthritis commonly affects several joints. If it affects the right wrist, it will affect the left wrist, and has morning stiffness. So the doctor will look at your story and the pattern of your disease. Secondly, there are those which are inflammatory and non-inflammatory, that they cause certain chemicals to be released in the body. So they'll do a test to check, is yours inflammatory or non-inflammatory? And that also informs, contributes to making the diagnosis. Your story, the lab tests, and then the x-rays. The x-ray, usually we do it to check, is the joint still is damaged or is still okay? And we assess that one to decide on what kind of treatment should give you. If the damage is early, we want to be aggressive so that the damage is minimized. So you are done clinical evaluation, laboratory test, and radiological test, x-ray specifically, and those can help us in making a diagnosis.
All right. If it goes untreated for a long while, or if it's poorly controlled for a long while, can it cause maybe any other issues to other parts of the body?
Yes. One of the most important things about arthritis generally is the disability. The fact that you are disabled and unable to carry out activities of daily living. And that is something big. You find yourself, you are a lady, you are unable to make your hair. You are unable to tie your bra. You know, those are issues. But also, arthritis does not come singly. You know, like rheumatoid arthritis can affect the lungs, can affect the liver, can affect the heart, and it has been found that the patients with rheumatoid arthritis, their lifespan is 10 years less than their age match control in the general population. So it reduces the duration of your stay in the world. It reduces and stops you from working. By 5 years, over 50% of patients with rheumatoid arthritis are unable to work. And those are serious consequences. But if you talk about something like lupus, before the treatment, the management of kidney disease and infections was improved, many of them, over 50%, do not reach 10 years. They die from the disease. But those are some of the areas that we are trying to. And when you take about gout, for example, gout is not just the pain that stops you from working. Gout can affect the kidney, and you can get kidney failure. And the combination of gout, hypertension, high cholesterol, which they commonly come together, and high blood sugar, is a contributor to premature heart attack and sudden death, especially among the young people.
Wow.
Yes.
Okay, so it can actually be fatal.
Arthritis can be fatal.
It can be fatal.
Yes.
So the early signs of the arthritis is just what you talked about.
Joint pain.
Any kind of joint pain.
If you get
swelling.
joint pain, seek medical advice.
Yeah.
Don't waste time. Don't go for Panadol or Dawanol or something.
Like
just,
you usually do.
Yes. Yeah. Just go to the nearest health facility so that they decide what you have and they treat early.
Okay.
Yes.
Before we get to talk about maybe the treatment options available, let's look at prevention. Am I able to prevent any of these kinds of arthritis? I know you've talked about my diet, and you know, statistics or research shows that the vegetarians are not as prone, you know, to arthritis, these kinds of arthritis, including rheumatoid. But are there any other ways that I can be able to just ensure that I am preventing myself from getting any of this?
Yeah, thank you very much. That's a very, very important issue. We've talked about diet.
Yeah.
Diet is very important in terms of prevention. Overall, for all non-communicable diseases, diet that is rich in vegetables, diet that is rich in fruits, is a magic bullet. It can prevent arthritis, can prevent hypertension, can prevent diabetes, can prevent cancer. So it's a magic bullet. The second thing is exercise, physical activity. Physical activity, if there's an invention that is waiting to be invented outside there, is one capsule that can, one drug, which if you take, will give you the benefits of exercise. And that has never been found. And I don't think it will be found. So since that drug is not there, people should just become active.
There's no drug for it.
Yes.
Yeah.
Physical exercise. Yeah. Physical exercise will prevent diabetes, hypertension, will give you a body weight which is bearable. You know, one of the problems with osteoarthritis and arthritis is that the body, your weight is too much for the joints. You know, even if you're a human being, there's an amount of weight that the joints are supposed to bear. If the weight goes beyond what we call the ideal body weight, you are straining the joints. And not only straining the joints, straining other tissues of the body, and therefore you are predisposing yourself. So the second, apart from diet, the second one is exercise and maintaining an ideal body weight, especially if you are predisposed. But the third one, and most important, also very important, is when you get you know, any problem would be solved when it is still small. Any problem in the world, whatever problem can be solved when it is small. If you allow it to grow, then it becomes insoluble. So people should be able to, once you get a small complete arthritis, seek medical attention so that it can be prevented before it explodes. Yeah. Yes.
Yeah.
And those who are being diagnosed, to prevent damage, you must stick to your medication. Yes. And follow up exercise program and follow up with your clinic appointments.
Yeah.
Yes.
Is it curable?
Yes, some which are curable. You know, cure is a situation whereby damage is prevented. You know, people think that cure is a situation whereby now you don't take medicine. But there's some conditions like diabetes, like hypertension, that are, we can say they are cured. When your blood pressure was high and is normal, and you are normal walking around doing your things, you are like cured. But that cure is maintained by taking a certain kind of lifestyle, taking medicine, taking hypertension. But if you talk about, for example, gout, gout is curable because we know that it is caused by high proteins, a lot of alcohol consumption. If you stop taking alcohol, you stop excessive nyama choma and other diets that lead to high uric acid, we will say it is cured because we have drugs also capable of bringing the uric acid down. And once the uric acid is normal, you will not get any attack of gout. And for us, that is cure. And one of the reasons why we are looking for diseases, we are looking for various causes of diseases, genes and so forth, is so that we can intervene at that level and stop the disease from manifesting itself, and we will have achieved cure. But then the other thing about cure is effective treatment. You know, the biggest, the most exciting field of medicine is actually in rheumatology, because we are always looking for mechanism of disease and intervening with novel treatments. And when you can intervene at that level, where the antibodies that come to attack the joints cannot come into the blood, we will say you are cured. But you know that cure is maintained by medications. And those medications, some of them are beyond the reach of an ordinary person. Yes.
Because they're expensive?
They cost a lot of money. I don't know whether that is expensive. Because for me, the most expensive drug is the one which does not work.
Okay.
Yes. Whatever it is you take which is not working, even if it's 1 shilling, is very expensive. It's more expensive than something which costs 1,000 shillings which is working.
Never thought of it that way.
Yes.
I get you. I get your point.
Yes.
So, when we talk about, lifestyle and, watching our diets,
yes,
most diseases or complications are linked to red meat. And that is what most of us eat. That is what most of our ordinary households get to consume. So where would you advise we get our protein from? Because that's the easiest protein, I think, for most. I don't want to talk for everyone, but I'm assuming, you know, like I can go to the butchery nikatiwe nyama ya 100. You know, it's affordable at the same time. So where do we get our protein from?
You see, when we are talking about diet, we are talking about moderation. Moderation, not total abstinence. It's moderation. Because some people are excessive. Excess of anything is dangerous. Even excess of eggs, vegetables, and so forth. For example, if you take the body, if the body is a house, for example, if I'm taking the analogy of the house, for a house to be complete, you must use cement, sand, bricks, water, metal. Although bricks are strong, you cannot, in the window you must put a glass. So what I'm trying to say is that you need to draw your minerals to make your body from various sources. Even meat is okay, but not excessive. And you know, excessive consumption of meat is associated with the gout, high cholesterol and so forth, and also is associated with the cancer of the colon. So, you know, these are issues that you have to be moderating. I've also known people who have abstained from all proteins, animal proteins, and have died from complication of vitamin B12 deficiency. So it is like running from a buffalo only to meet a lion. So you have to decide. You have to walk a tightrope and know what is good for you. Yes.
So you're not saying don't eat at all, but just eat it in moderation.
Yes.
As long as you ensure you're having a balanced diet every single time you're having a meal.
Yes. Don't take it excessively. Whatever you're taking, don't take it excessively.
Yeah.
Yes.
Okay. What are some, would you say, are some day-to-day challenges faced by RA patients, that's rheumatoid arthritis patients?
The RA, one of the challenges is to living with pain. Pain is a common problem. They're always having pain. And this pain can lead to depression. This pain can bring blood pressure to be high. This pain can cause, can make you unpleasant, can cause to you even your marriage, your relationships, can be interfered with. If you're a person who is always in pain, you become unpleasant. And number two, the idea that you cannot carry out activities of daily living. If you go to the toilet, for you to rise up, somebody must come and lift you up. Imagine. It's a lot of challenge. It's challenging and embarrassing. Everybody loves privacy. That's why people lock toilets. When when they are in the toilet, you lock the door. And that's one of the embarrassments you are caused when you go to prison, because the toilet in prison are the only ones without a door. Because that humiliation is part of the imprisonment process. So imagine you are being humiliated every day. Every day, somebody has to pick you up, somebody has to apply, to clean you up with tissue paper and all that, because of arthritis. But also it interferes with some of your privacy. You know, some of them have got deformity of the fingers, and even if they have money in the bank, they cannot punch the ATM. So they have to give their password to another person. And there's nobody. You know, in this world, many people, like myself, you don't even trust yourself. So how do you start trusting another person? Huh? Yeah, the only trustworthy person is somebody who has died, as you confirmed he has died. That's the only person you can trust. So imagine trusting your password and everything to somebody. But the other challenge we face in this country is financing healthcare. The health financing system is always negative towards what they call chronic diseases. But these are the diseases that are there. So, for example, they will not cover you. NHIF, SHA, whatever you call them, will not cover you when you have arthritis. And that is a problem.
It doesn't cover that?
It doesn't cover adequately. It doesn't cover. For example, they can cover you when you have cancer, for chemotherapy. They can cover you when you need dialysis. But when you have lupus, which can lead to dialysis, they don't want to treat you. until when you get dialysis. It's like saying somebody, you pay, it's almost like the terminal benefit, it's called what? The insurance which you pay for burial, where you keep on paying and you can sleep hungry and keep on paying, but when you die, they swing into action. What kind of insurance is that? You know, life is for the living. So it's good for something that prevents you from deformity and from dying, not waiting for you to have complications. Then they come and start covering you. You know, those are some of the challenges we are facing. But the other one is stigmatization. The environment is not conducive. We don't have adequate ramps. We don't have lifts. We don't have buses which can accommodate wheelchair or somebody with arthritis. Many of my arthritis patients have died because the bus is in a hurry to leave. You are wasting their time coming very slowly, so the bus driver just swings and you fall down and you die. So even the community is not accepting and accommodating disability and arthritis. So we are ostracized by the community. They are not, it's not very friendly. But there are many other challenges that you can face. But you see, like now, when the world has become individualistic, nobody wants to care. Many of these patients need care at home, but there's nobody to care for them anymore. Everybody is busy with their own things. Even those who are at home are busy with their mobile phones. They are not going to look at you. That have you cooked or have you eaten? They'll just cook for you and then they continue with the TikToks and so forth. So they leave you alone. So the loneliness is real in patients with arthritis.
Is it very common in the country?
Arthritis is very common. We are talking about arthritis in general, back pain and all that. I told you it's about 10%. Rheumatoid arthritis is about 1% of the population, and that is huge. Lupus is about 0.5%. So it is common. Anything that affects 10% of the population is huge. If we are talking about Kenya with a population of 50 million, we are talking about 5 million people with some form of arthritis, and that is a national disaster, something that requires attention. And that's why the WHO in the year 2010 declare the year 2010 to 2020 the bone and joint decade. And it was enhanced from 2010 to 2020, then 2030. We are still continuing. And the reason we are doing that is to tell people that arthritis is a common problem in the society, that the governments need to budget and have strategic plan for dealing with arthritis. It's the leading cause of deformity, leading cause of absenteeism from work, leading cause of early retirement. And then again, the government should put money to do research on remedies that can alleviate the problem of arthritis, and should put resources for management of arthritis. And that's why it is very, very important. It's something that should be at the top of strategy. I know we are talking about cancer and all that, but this is something which is more common than those ones and should be at the top of strategic thinking in those who are managing health programs in this country.
Okay, I hear you. Let's get into the treatment options available. What are the options for someone with any of these kinds of arthritis?
Okay, let me start with rheumatoid arthritis. When the patient comes to you, he comes because he is having pain. And therefore, the patient should feel good as soon as possible and as long as possible. So you have pain, drugs that address pain and inflammation. But then you have medications that will modify the disease. You know, we say that the disease is because autoimmune, the immune process is fighting the body. So you have these diseases, the drugs that will prevent that. We call them disease-modifying and traumatic drugs. And there are many of them, both synthetic, which were made in the laboratory, and the ones which are biologic, which go and prevent. And they are all available. But apart from medications, you need to, let me talk about the synthetic. We have things like hydroxychloroquine, leflunomide, salazopyrin, methotrexate. Those are the key drugs for rheumatoid arthritis. But apart from that, you have rehabilitation facilities, physiotherapy. And this is something which can be availed even in the local setting, in the local health center. It is painful that if I have a patient and tell him, can you go back to Rachonyo and go for physiotherapy? They tell me, for me to go for physiotherapy, I have to go to Kisumu or Homa Bay. While physiotherapy can be available in any health center, absolutely, if in health facility, even a dispensary, it doesn't require much to have rehabilitation. Then, if you talk about, then there is the option of surgery for the joints which are completely damaged. And that also obtains for osteoarthritis. You manage the pain, you have rehabilitation, but again, you have surgical intervention. And I'm happy that we have orthopedic surgeons almost in every county hospital nowadays. But they don't go hand in hand with the rehabilitation. One of the reasons why patients, for example, go to India for knee surgery and all that is because of rehabilitation. You know, them, the rehabilitation is very advanced. Here, even when you are done knee surgery, you can remain in bed and develop other problems because you are not well rehabilitated. And therefore, people say, oh, I've seen so many people who have been done hip surgery replacement and hip replacement surgery, and they have never walked. And the reason why they have never walked is because of poor rehabilitation services. But gout, for example, apart from the diet, we have medications that reduce uric acid, which are available cheaply and widely in this country. Yes.
Yeah. What have we not touched on the treatment options? Lupus?
Lupus, yes.
Lupus, yeah.
Yes.
Lupus.
Lupus is a big thing.
Yeah.
It's a fast growing problem, very discouraging, very debilitating. And we thank the people who have come forward and formed the Warriors group, which support lupus. And we have medications. We have the immune suppressants, like azathioprine. We have mycophenolate mofetil. And we have hydroxychloroquine. The problem with this drug is that you take them long term, and maintaining the treatment is a problem. Maintaining most people do it out of pocket, but to expect people to use their income, which has been raided by all sorts of taxes, now your income has decreased out of your pocket, money in your pocket, and then you are supposed to use it to maintain your health. That's a failed system. A system that expects you to pay for their health is failed. Yeah. So when you continue taxing people, you must provide the medications and the drugs. And really that's what we are saying. Yeah. That there's need for the drugs to be available in the local facility to treat the locally available conditions, including lupus and so forth. And you know, lupus, the commonest one of the common problem is infections, and there we need to have antibiotics available. The other problem is kidney problems. You need to have dialysis services available, and the opportunity to have affordable renal replacements surgery. That should also be a priority when you're dealing with health for lupus. But the key is, once you make a diagnosis, can they afford the laboratory tests? Are the laboratory tests available? You know, one of the other challenge that I didn't mention is unavailability of comprehensive services at the so-called referral hospitals. You know, a referral hospital is a place where if you're referred, you get services. It's not on the size of the acreage of the facility or the flamboyance of the buildings and the flower beds. No, it is what is it that if you go to that hospital, are you going to get? What service? And I think this is something that needs to sink. We don't need to paint the gate nicely and write referral hospital, teaching a referral hospital, when there's nothing, there's even nothing to teach with inside there. Yeah. So we need to improve services to the people, facilities, medicines, laboratory tests. Many of these hospitals that lack basic laboratory tests that can help you make a diagnosis of lupus, for example. Yes. Yeah.
So we from just your point, it feels like we still have a long way to go.
we are moving on. Number one, we have a long way to go because number one, we have few specialists in rheumatology.
Okay.
In this country, we are about 10, 12.
Only.
And only 2 are specialized in children. And I told you that arthritis can also affect children. So we need to have these specialists in all the referral hospitals. So you cannot say you are a referral hospital when a patient with lupus is referred there, will go away unattended to. So we need to have the specialists. Number 2, we need to have services that support the specialists. Because from what we have seen, patients are frustrated that they cannot contact the relevant specialist. So can you develop that service? We need to develop support services. You need to develop physiotherapy, occupational therapy. You need to develop nursing staff. You know, nurses are not just nurses. They are also nurses who are specialized in rheumatology.
Yeah.
So those nurses are able to answer the patient's question. When the doctors are very few, we need to develop that cadre of staff so that they are able to answer to the questions of the patients. You know, patients sometimes just call. I'm going to a pharmacy, I've been given this, should I take this one? And there's nobody to call. The doctor will not pick your phone.
Yeah.
There's no call line and so forth. That's a problem.
Okay.
Then the other service you need to develop, if I just have a single joint pain, or I'm curious, I want to know, do I have gout? And I want to go to a government hospital. You know, the government hospital, if you're not brought by ambulance, or carried in a stretcher, or carried by people, you will see what the Gen Zs call utaona siku mrefu, because nobody will listen to you. We need to have a place which is friendly. You just go to answer a question, ask a simple question, and you are answered. You say, me, I just want to check, I've been having a headache. What is happening with me? And you are normal. Can you get such a place? You know, those are services that are there because that's what will help us to prevent getting complicated diseases appearing to us. So we are a long way to go. Our services are not friendly. They are not comprehensive. The facilities are not there. Medications are not there in many of the hospitals. Even in private hospitals, some of them don't avail the drugs that are required by patients in the country. Okay. So we have to import some drugs. People go to India to look for drugs. And when they bring them, they are very expensive. If you have to subsidize cost of things, as much as we subsidize cost of housing, affordable housing, we should also have affordable medications and affordable health for all.
Right.
People should not sell their land or go hungry.
To cover for their medication.
Yes.
I agree with you on that. Now, for those who are looking to get into the medical field, Dr. here has already mentioned that there is a gap when it comes to the number of rheumatologists that we have in the country. So maybe you can look into that. You can get into that side of medicine. As we almost come to a conclusion of our conversation today, maybe are there myths around arthritis in general that you would love to demystify?
Yes, there are several myths about arthritis. You know, there are those who believe that, for example, lupus is a sign of taboo or witchcraft. And I stigmatize in that sense. I've had people who have been ostracized that this disease you're having is because your husband has not paid enough dowry.
There's such a thing.
Yes.
Yeah.
We did not pay dowry. So you have to pay dowry. And the patients are not understood. The people need to understand the arthritis. Then those who believe it's witchcraft, there are those who believe that there's no treatment and you can drink a lot of soup or some arubaine or something. You know, there are some herbal things. You know, there are diseases which the cause is known, the treatment is known, and there's no need of taking unproven remedies. There are so many unproven remedies, and arthritis is a fertile ground for unproven remedies. And everybody says, I can treat arthritis.
So many mitishambas.
So many mitishamba can say they can treat arthritis. But arthritis is a specialized medicine, just like cardiology, and there are specific ways of making diagnosis and treatment. And people should avoid unproven remedies and illogical assertions about various issues about arthritis. And there's no witchcraft about arthritis. There are those who believe that somebody looked at my knees badly and put pieces of glass inside there, and therefore without me visiting a mitishamba or a witch doctor, this thing cannot be cured by medicine or by surgery. And people suffer and end up in a wheelchair and end up being crippled because of those kind of beliefs.
Yeah. And with that said, do you feel we still have a long way to go in matters awareness? Because if we still have people who believe, someone looked at my knees badly, that's why they're in pain or whatever.
Yes, awareness is one of the areas we work on as an association of arthritis or rheumatic diseases. And we also have in this country a foundation called Uwezo Rheumatology Foundation. And the basic thing is to improve the understanding of doctors and medical workers in Mashinani, in all the counties, of arthritis and how to handle emergencies. But also we are forming patient groups that are able to advocate for their rights and their needs, and also to educate people. And we also thank the media, because when we come out like this and people hear about arthritis, they know that arthritis exists. But we also have various publications, like we have a book called Understanding Arthritis, Understanding Back Pain, which is out on sale there, and these also help in informing the public. But the good news is that also we are working with the East and Central Africa College of Physicians, and we are soon going to start at the Mater Hospital training of rheumatologists in this region for the whole of the East Central Africa region. We are going to start training there in Mater Hospital, and at the Aga Khan Hospital here they are also soon opening a program for training pediatric rheumatologists, and therefore the future looks good. It is not just for Kenya, it's for the region. Because when I talk about no rheumatologists, can you imagine that in the whole of Tanzania, there's only one rheumatologist working, and they are more than us. They are more than over 50 million, they are more than us. And you have one working in Zanzibar who was actually trained from Kenya. In Uganda, you have only one. In Dar es Salaam, in Rwanda, you have one.
How come that's the case? Is it that it's just not a common...
It is a newer discipline, but also it's more exerting, because this is one of the field of medicine. Number one, where it requires that you talk to the patients. The world has gone more individualistic, and people don't want to talk to one another. People want to talk to each other. And secondly, it is still the medicine where you have to talk and touch the patient to make a diagnosis. People are running to the disciplines where you put a patient in a machine like this, and the machine tells you the heart is like this, whatever. And also in area of preventive medicine, where people want to blame something else. They don't want to be blamed for making a decision. So that's why we are few, but the number is growing. I'm happy that in the last 20 years, we have grown from 0 to 12. That is huge, while other countries have been stagnant. Yes.
All right. We come to a close of this conversation. Maybe just your parting shot in like 30 seconds.
I think arthritis, I can say that arthritis hurts. Talking helps. Let people not suffer in silence. When you have joint pain, go and talk to a doctor or a medical practitioner, and he will lead you to the right direction. Thank you.
All right, we appreciate you gracing our show this morning. Thank you so much for joining us. This is where we call it a wrap on this conversation, and also put a cap to today's Good Morning Kenya. Thank you so much to each and every one of you who started off with us at 6:30 a.m. until this moment. We meet again tomorrow, God willing, same time and place. My name is Vivian Degwa. Do enjoy the rest of your viewing. Goodbye.